What separates high quality psychological testing from testing light or maybe somebody going through and getting it done with insurance?
I would say that we take a neuroaffirming view to testing or an assessment. And basically what that means is there's multiple models of like autism and like neurodivergence that are coming more to the forefront now. So there's the medical model, which is purely based off of the DSM or our like manual for diagnoses. You know, that's the system we've been using for years. And then more recently, they're starting to develop a little bit more of like a social model. When we take a neuroaffirming stance to testing, there's going to be multiple parts to that. One part is the clinical interview where we kind of dive into everything. We talk about development, childhood, education, any ongoing medical issues, because those can have a bearing on a diagnosis. We talk about mental health, communication, socialization, behavior, vocational skills, thorough background and history. And then I do one-on-one testing and our testing for neurodivergence. There's questionnaires for executive functioning, social skills, mental health, and personality, those. So for ADHD, I use the executive skills questionnaire. For autism, I use an interview measure called the MIGDUS-2, which is really seen as more of a neuroaffirming measure. One of the things that I think does set us apart is that we do use more neuroaffirming measures than, say, what an insurance-based evaluator might use.